Hi, I'm Bill Engle. I'm a registered nurse on MG4 at St. Mary's Medical Center. I work on a med-surg telemetry floor. We are striking to get better staffing levels. We unionized a year ago because of those very issues, and we've been at the bargaining table with Trinity for the last 15 months. We want safe staffing levels. We just held a marathon bargaining session from 9 o'clock in the morning last Thursday to 3:30 in the morning Friday. And we made no progress, so here we are. We just had a rally in the background here at 12 o'clock. As they said, we've lost 243 nurses in the last year and a half, 2 years. It's not just one thing in particular, they're all tied in together. Staffing is the number one, but to get nurses into the hospital, there's certain things that they expect, which is a good salary, which is competitive benefits, which is good tuition reimbursement. When you have hospitals like Princeton Medical Center and Capital Health up in Hopewell, New Jersey, who offer $5-6 more an hour, better health benefits, we can't get the nurses that we need in here. And it severely, severely affects the way and the type of care that we can give to our patients. We believe we just formed a Mid-Atlantic Trinity, which encompasses 5 hospitals, one of which we are. And they say that all of the money within the region, Nazareth Hospital, Mercy Fitzgerald, MHOP, St. Francis, all that money stays within the region. But we are by far the most profitable hospital, not only in our region, but in all of the state of Pennsylvania. St. Mary's Medical Center makes north of $40-45 million a year in profit. So we believe they use the money to prop up the rest of the Mid-Atlantic, which is okay. But we too deserve some of that. This company is stationed out of Livonia, Michigan. They have come into our community, our hospital. They have just taken money hand over fist. And all we're asking them to do is to reinvest in the nurses and the community that we care for. We didn't ask them to come here. They came to us, okay? And all these decisions, their negotiator at bargaining last week said that these decisions are coming from the highest levels of Trinity. And that's the CEO, the COO. Well, they are so far removed. They don't know this community. But those of us who work here, we walk amongst those that we care for. They are in our heart. And they helped us so much in the first wave of the pandemic when we reached out to them for the PPE. And we just want to give the great care back to them. We got 990s, and that's publicly available information. Over the last couple years, our CEO has gotten a 50% raise. The Trinity lawyer locally here got a 76% raise. The CEO of Mid-Atlantic Trinity got a 20% raise. We are put in positions every day that we have to decide what to do next. The norm used to be 4 or 5 patients per nurse up on the type of floor that I work on. There was a rare occasion that we would go to 6 or 7. Well, now that rare occasion, while I can't say it's the norm, it's not so surprising that we walk into. And that puts us in an inevitable position of having to decide whether to change this poor elderly person or go give meds to somebody else. And we have to make these decisions on the fly. So we leave very unfulfilled, feeling terrible for our patients because of that. This is a microcosm of our country in general. This is happening here with us with a corporate healthcare system, but it's happening in other communities and other states across the country. And nurses need to stand up for themselves and say, look, We don't begrudge you making profits, but when you not sharing the profits puts our patients' lives in jeopardy, that's our line in the sand. Because we got into this to care for people and keep them safe, and you never want to mess with a nurse who can't do that. Thank you.